The day you stop your statin, your body does not stay the same. And after 65, some of the risk can return before you feel a single warning sign. If you want to stay healthy and independent as you age, hit that subscribe button right now. We share simple, science-backed health tips like this every single day, and the next one could help you avoid a serious mistake. Over the years, doctors and researchers have seen the same pattern again and again. Many older adults stop a statin because they feel fine, or because the bottle runs out, or because they think their cholesterol problem is gone. But here's the thing. Feeling fine is not the same as being protected, and normal cholesterol on medicine is not the same as being cured. By the end of this video, you'll know what changes first, what most people get wrong, and what to ask before you ever stop this medicine. Now, before we continue, tell me your age and where you're watching from in the comments. This helps us understand who we're helping. Here's what most people get wrong. They think statins are like pain pills. You take them, the number gets better, and then you can move on. But statins do not work like that. Not a short fix, but ongoing control. They lower LDL, which means the sticky cholesterol that can build up in your artery walls. And they also help calm plaque, which is the fatty buildup inside those blood vessels. So if your cholesterol looks better now, what does that really mean? It usually means the medicine is doing its job, not that the job is finished. A 2024 study from the University of Hong Kong and Harvard T.H. Chan School of Public Health found that older adults ages 75 to 84 who stayed on statins had a 21% lower risk of cardiovascular disease. In adults 85 and older, the risk reduction was 35%. That is a big deal. Why? Because it tells you the protection can still matter late in life. And there's another part most people never hear. A 2024 systematic review from Queen's University, the University of Toronto, the University of Ottawa, and the University of British Columbia found that outside of end-of-life care, stopping statins was linked with worse outcomes in older adults. The review found a higher risk of cardiovascular events and death after stopping, although the researchers also said the evidence had limits and should be interpreted carefully. That's the honest answer. Not panic, but not casual either. So no, this is not about saying every person over 65 must take a statin forever. That would be too simple. This is about knowing that stopping changes real biology inside your body, even if you cannot feel it right away. Number 5, the fast rebound. Most people think cholesterol drifts up slowly after stopping a statin. But actually, your body can react much faster than that. Think of your liver like a factory. A statin acts like a supervisor standing at the control panel, slowing cholesterol production down. When you stop the pill, the supervisor leaves the room. The factory can ramp back up fast. A 2024 study from the University of Castilla-La Mancha found that after just 4 days off a statin, LDL went up 30%. Total cholesterol went up 18%. Triglycerides, which are another type of blood fat, went up 17%. That was after only 4 days. Not 4 months, 4 days. Did you hear that? Your blood work can change before your routine follow-up even arrives. And that matters because many people say, I only stopped for a week, or I just wanted to see how I felt without it. But your body may already be changing during that little experiment, not because you did something dramatic, but because the medicine stopped blocking the process it was built to block. So what should you do with that information? First, do not test your body by quitting on your own. Second, if you and your doctor decide to reduce or stop a statin, ask when your cholesterol should be rechecked. In many cases, a repeat lipid panel, which is the cholesterol blood test, is checked in about 6 to 12 weeks. Third, support your numbers with food right away. A simple breakfast could be 1 cup of cooked oatmeal, 1 tablespoon of ground flaxseed, and 1 small apple. That gives your body more soluble fiber, which is the kind that helps pull some cholesterol out like a sponge. At lunch or dinner, think simple. Add 1/2 cup of beans to soup or salad. Use 1 tablespoon of olive oil instead of butter. Eat 4 ounces of salmon, sardines, or trout 2 times a week. Have 1 ounce of nuts, about a small handful, on most days. Will that replace a statin for everyone? No, but it gives your body less work to do. And if you miss 1 pill by accident, do not panic. 1 missed dose is not the same as quitting. The danger is turning 1 missed pill into 1 missed week. But wait until you see number 4. Quick question. Have you ever had muscle pain while taking a statin? Comment yes or no below. Number 4, your arteries lose quiet protection. Most people think statins only change a lab number, But actually, they also help protect the inside lining of your blood vessels. Imagine plaque like a crack in an old road. When things are stable, traffic keeps moving. But when the crack weakens, the road can break apart. In your body, that break can become a clot, and a clot can block blood flow to your heart or brain. That is why stopping matters even when you feel normal. Your arteries do not send a text message. They do not tap you on the shoulder. Trouble can build in silence. A 2021 study from the University of Southern Denmark looked at more than 67,000 adults aged 75 and older who had used statins long-term. The researchers found that people who stopped had a higher rate of major heart and stroke events than people who stayed on them. In older adults taking statins to prevent a first major event, stopping was linked with one extra major event for every 112 people who stopped each year. In people taking statins after a heart problem had already happened, stopping was linked with one extra major event for every 77 people who stopped each year. That is not a tiny signal. That is a real-world warning. So what can you do besides taking the medicine as directed? Protect the road from every angle. Walk 20 to 30 minutes most days, even if you split it into 2 short walks. Keep blood pressure in range. If you smoke, get help quitting. Build meals around plants more often. Half your plate vegetables. A palm-sized piece of fish or chicken, a fist-sized serving of beans, lentils, or brown rice. Little choices matter because plaque does not come from one bad dinner. It grows from repeated patterns. And if you already had a stent, a mini-stroke, a stroke, or bypass surgery, let me be clear. Stopping a statin on your own is especially risky. In that case, the medicine is not just about your cholesterol number. It is part of your protection plan. But number 3 may be the hardest truth of all. Number 3. You may feel nothing while risk rises. This is where people get fooled. No headache, no chest pain, no flashing warning light. You may stop your statin and feel exactly the same for days or weeks. That can trick you into thinking nothing changed. But high cholesterol is often a silent problem. Plaque is often a silent problem. Rising risk is often a silent problem. Look, your body does not always announce danger early. A clogged pipe does not make noise until the water stops moving. Your arteries can be the same way. That same 2021 University of Southern Denmark study matters here too. People who stopped long-term statins had a 32% higher rate of major cardiovascular events in the primary prevention group and a 28% higher rate in the secondary prevention group. The key point is this: the extra risk showed up in outcomes, not in how people felt day to day. So if symptoms are not a good guide, what is? Your history, your numbers, your follow-up. Ask yourself 3 simple questions. Why was I put on this statin in the first place? Was it because my LDL was very high because I have diabetes, or because I already had a heart or brain event? What was my last LDL number? And what is the plan if this medicine is causing side effects? Those questions are better than guessing. Keep a small health card in your wallet. Write down your statin name, your dose, why you take it, and your last cholesterol result if you know it. That sounds simple, because it is. But simple tools keep older adults safer. Before we go further, if this is making sense so far, hit that like button. It tells me you want more videos like this. Now let's talk about the reason many people stop in the first place. Number 2, stopping may not fix the problem you think it will. Most people think, my legs hurt, so the statin must be the reason. But actually, many aches after 65 come from other things. Arthritis, dehydration, low vitamin D, a thyroid problem, a new exercise routine, poor sleep, even stress. A 2022 study from the University of Oxford looked at almost 155,000 people and found that more than 90% of reported muscle symptoms in statin users were not actually caused by the statin. For every 1,000 people taking a moderate intensity statin, the treatment caused about 11 extra episodes of muscle pain or weakness, and those were usually mild. That means the muscle pain people feel is real. But the pill is not always the real cause. That is why stopping on your own can backfire. You lose protection, but the pain may still stay. So what should you do if you truly think the medicine is bothering you? Start with a conversation, not a goodbye. Ask your doctor whether the dose can be lowered. Ask whether a different statin makes sense. Ask whether taking it at a different time might help. Ask whether you need a blood test for muscle injury if the pain is severe. And ask whether another cholesterol-lowering medicine like ezetimibe could be added or used if the statin cannot be tolerated. Here's the thing. Not every problem needs a full stop. Sometimes it needs a tweak, a smaller dose, a slower plan, a switch. Also, notice the warning signs that are not normal. Mild soreness is one thing, but severe weakness, dark urine, fever, or pain that makes it hard to stand up is different. That needs medical attention. And if your reason for stopping is, my cholesterol is normal now, remember this. A quiet smoke alarm does not mean there is no fire risk. It may mean the system is still working. But the biggest point is still ahead. Number one, the real danger is stopping without a plan. Not every older adult should stay on a statin forever. Let's be fair about that. In some people with serious frailty, major drug interactions, severe side effects, active liver problems, or limited life expectancy, the conversation changes. In those cases, a doctor may decide that the burden is greater than the benefit. That is called deprescribing, which simply means safely reducing or stopping a medicine that may no longer fit your goals. A 2024 systematic review from Queen's University, the University of Toronto, the University of Ottawa, and the University of British Columbia found something important. In people near the end of life, stopping statins did not appear to change short-term death rates much. But outside that setting, stopping was linked with worse outcomes overall. So the real question is not, should everyone stop or stay? The real question is, does this medicine still fit your body, your risk, and your life right now? That is the adult way to think about it. And there is one more clue. A 2020 study reported by Harvard-affiliated researchers found that adults 75 and older who use statins had a 25% lower risk of death from any cause and a 20% lower risk of death from cardiovascular causes. Again, that does not mean statins are perfect. It means the upside can still be meaningful in older age. So if you are thinking about stopping, make a plan first. Ask these exact questions. What benefit am I getting from this drug? What risk comes back if I stop? Is there a lower dose option? When should I repeat labs? What symptoms mean I should call you right away? If your doctor can answer those clearly, you are making a decision from strength, not frustration. I'd love to hear your story. What made you click on this video today? Share in the comments. Now let's pump the brakes for a second. I'm not saying this to scare you, but you should never use a YouTube video as permission to stop a prescription on your own. There are times when stopping suddenly is a bad idea, and there are times when staying on the wrong dose is also a bad idea. Your safety lives in that difference. Watch for serious symptoms. If you have chest pressure, sudden shortness of breath, new one-sided weakness, face drooping, slurred speech, or sudden confusion, get emergency help. If you develop severe muscle pain with dark urine, call a doctor fast. If your skin or eyes turn yellow, or you have severe nausea and unusual fatigue, that could point to a liver problem and needs attention. Also, remember interactions. Some statins can mix badly with certain antibiotics, antifungal medicines, transplant drugs, heart rhythm medicines, and even large amounts of grapefruit. If a new doctor prescribes something, ask, does this interact with my statin? That one question can save you a lot of trouble. And if you are over 65 and taking many pills already, ask for a medication review once a year. Not because medicines are bad, but because your body changes, kidney function changes, weight changes, goals change. Your medicine plan should change only with guidance, not by accident. So you're convinced, but thinking, how do I actually do this? Start with the easiest step first. Do not decide alone. Call your doctor, your pharmacist, or your nurse practitioner before you stop. Even a short message through the patient portal is better than guessing. Next, make taking it easy. Put the bottle near your toothbrush. Use a 7-day pill box. Take it at the same time every day. Set one phone alarm, not 10. 1. Simple systems work better than heroic willpower. Then support the medicine with habits that cost little or nothing. A cheap breakfast of oats and fruit, a can of beans added to dinner, frozen vegetables in the freezer, a 20-minute walk after lunch, water instead of sugary drinks. If your doctor does reduce your statin, these habits matter even more. They are not magic, but they are powerful helpers. And if cost is the issue, say it out loud. Many generic statins are low cost. Some pharmacies offer discount plans. A pharmacist may help you compare options. Never go silent because of price. Look, there's a lot of noise out there about statins. Some people act like they are poison. Others act like they are perfect. The truth is usually quieter than that. If you stop a statin after 65, your cholesterol can rise fast, your artery protection can fade, and your heart and stroke risk may climb before you feel any sign at all. But that does not mean every person must stay on the same pill forever. It means the decision deserves a real plan. You don't need to overthink this. Start with just one action step. Ask why you take your statin and never stop it without knowing the answer. Your body will tell you if something is wrong, but sometimes it tells you late. Good planning helps you act early. If this helped you, hit that like button. And if you want more videos like this, make sure you're subscribed because we post new health tips every single day. Stay healthy, stay strong.